working as a guard, has been living with the patient throughout the illness. History has been given over the phone by the husband. The history given is clear, consistent for it, given in a chronological order. History could not be collaborated among all informants. History is unreliable but adequate. Complaints are insidious in onset, continuous in course, deteriorating in progression, characterized by irritability and anger outbursts, physically and verbally abusive, possession by deity, increased self-esteem, suspiciousness, decreased self-care, and hearing voices not heard by others since 2 years, which have increased from the past 2 months. Predisposing factor of physical illness. Precipitating factor could not be elicited. Perpetuating factor is critical comments by the father and the in-laws. Patient was apparently well, carrying out her normal household activities, taking care of a child when she suffered through strep typhus with an alleged history of encephalopathy, for which she was admitted to the ICU for 6 to 7 days. On being discharged, the patient stayed at a maternal house for 20 days, after which, when she went to her husband's house, they expected her to do the normal household activities. She denied to do so and would get irritable and scream at everyone. She believed she knows everything, and when anyone would say anything against her, she would get really angry. She started throwing household articles like the phone, keys, or the utensils at anyone who would annoy her, without caring if it were the children's or even her mother-in-law. She would be verbally abusive towards her family and villagers as well, and would constantly insult everybody around her. If anyone from the family or villagers would question her or provoke her, she would start abusing them for minutes with a threatening pose. Poke her, she would abuse them for minutes with a threatening posture. She also started getting physically abusive, where she would even pick up the stones to hit people. There was an instance where, on asking her son to return downstairs to her room, when he immediately did not return down, she picked up the stone and threw it at the house, breaking the glass window. She would also threaten all the neighbors, saying, "मैं पुलिस में चली जाऊंगी, मैं लड़की हूँ, वो मेरी बात मान लेंगे." Seeing this behavior, the husband separated from her, giving her a room downstairs in the same house to live with the younger son. The son was allowed upstairs, but she was not, and was provided with the basic grocery. This further got her irritable. She would get in physical fights with her husband, biting him, breaking the doors of the house. Now she would also curse everyone around, telling them something bad would happen to them as they would have wronged her. On seeing this, her father was called to the house, where all elders collected and tried explaining to her her behavior. The patient got more furious and started using foul language towards everyone, where her father tried calming her down, touching her shoulder, pushing her away from people who she was threatening. She got so angry that she started being verbally and physically abusive towards him and started cursing him that misfortune will favor him soon as he had wronged her. After many of the instances, she would also deny the fact that she had been physically violent with anyone. She also believed that people were the cause of the irritation as they had wronged her, and when they would say bad things about her, then only she would get irritable. When they would physically abuse her, so she was not to be blamed for her behavior. She also started having episodes of possession by deity, where she believed she was being possessed by her devta, who appeared when people would wrong her. All four limbs would start shivering on the mention of the name of the devta. There were episodes where she would start shivering and saying, "मैं देवी हूँ." She would get a dupatta, wrapping it around her head, dancing in the house and the garden area, calling all her neighbors. She would be seen lying on the floor, shivering on multiple occasions. After these episodes, she would not mention anything about them until people would question the presence of the devta, where she would be possessed again, screaming, "मैं सबको देख लूंगी, मैं देवी हूँ, मेरी पूजा करो." These episodes are frequently seen when someone would provoke her or make a critical comment like, "तू काम नहीं करती, नौटंकी करती है, तुझे शिक्षा नहीं दी है तेरे बाप ने." Previously, there were 1 to 2 episodes in a month. With passage of time, the frequency of these episodes increased to 1 to 2 episodes in a day. The patient started believing in God more, which was contrary to her previous nature. She would want to visit different temples to visit the Devta, hearing stories about them. She would sometimes get up in the morning, having a bath to visit the nearby temple. She also started believing more in her capability that she was correct in everything, as she had a pure heart and was incapable of seeing any wrong in the world. She believed her way was the correct way, and everyone was wrong, saying, "मैं सबको देख लूंगी." She also believed she was more learned and had better knowledge than anyone, saying, "मैं senior doctor हूँ, मैं देवता भी हूँ, मैं सब कुछ हूँ." She also started becoming suspicious about everyone. She believed her in-laws were plotting against her, saying, मेरे खिलाफ उल्टी साजिश करते हैं ये सब. When she would see her husband talking to the relatives or neighbors, she would question him about having an extramarital affair. She also believed it was her mother-in-law who was plotting against her, turning her son against her. She believed all the villagers and family members were laughing behind her, discussing why her husband had separated and blaming her and questioning her character. There was an instance where she went to the market to get her phone checked, where she believed she was being followed, believing मेरे पीछे लोग लगाते हैं ये लोग. She believed her in-laws were asking people to physically hit her. She also gave alleged history of being beaten by shoes, hot pans by her husband and all the neighbors. An instance where the neighbor would collect and beat her with shoes and stones. When a distant relative in the police service visited the house, she believed that everyone was plotting against her and was trying to get her captured by the police. So she ran away. As time, ma'am, according to the father, nahi. As time, but the husband was physically abusive towards her. As time passed, she also started believing her father had started plotting against her with her husband and would curse him, saying, "तुझे भी ठिकाने लगा दूंगी, सबको देख लूंगी मैं." She also started working less and would not help in any household chores. Her mother-in-law would make critical comments about how her family had not given her the right teaching and she was just lazy and did not want to work. She also hardly would want to cook, asking a younger son, "जब जा दादी के पास जाकर खा ले." She would complain about the limited grocery provided to her and would not hardly cook. She would cook a meal and would eat the same meal for 3 days. She hardly would clean the house, collecting all the dust and the waste. She even stopped caring for a child, unable to dress him properly for school or provide him with a nutritious diet. When a sister would come to visit and would ask her to help in the household chores in her house, she would get irritable and screaming, "मैं बड़ी हूँ तेरे से, तू मुझे मत बताया कर, मैं क्या करूँ." There's also a history of hearing voices not heard by others. She believed her Devta was speaking to her. There's no diurnal variation in this, and the Devta would tell her, "इसको सम्मान करो सब, इसको मारो मत, मैं सबको ठिकाने लगा दूंगा." Negative history. There is no history of sustained cheerfulness, overspending, decreased need for sleep, over familiarity, big planning, or over grooming. No history of low mood. No history of hearing of voices not heard by. No history of seeing things that others cannot see. Thoughts being introduced or taken away from the mind by external agency against the will. Or own thoughts being heard aloud or being known to others against their will. Feeling actions or sensations being under the influence of some external agency. No history of repetitive thoughts or compulsive act. No history of head injury. No history of abnormal body movements associated with tongue bite, frothing from mouth, or uprolling of eyebrow. No history of vomiting or unexplained weight loss. No history of any substance abuse. In treatment history, there is no significant treatment history present. In past history, there is history of scrub typhus and encephalopathy and respiratory failure 2 years ago. There is no significant psychiatric illness in the past. Family history, she's 14 order out of 6 siblings of a non-consanguineous marriage. Patient lives with her husband in the same house but separated from the past 2 years. She is living in the ground floor. No significant medical history in the family. No history of any psychiatric illness in the family. Patient does not have carnal relation with her husband and in-laws. The economic head of the family is the husband. Patient is closest to her mother since childhood. The family is not supportive towards her illness. They do not understand the need for checkup and follow-up, and they make critical comments about her behavior. Birth history is normal vaginal delivery at home. Birth weight is not known. She cried after birth. There is no history of fever, synopsis, prolonged jaundice, breath holding spells, or abnormal body movements, or admission of ICU. No history of antenatal exposure to extra toxins. No history of Intrapartum or postpartum complications. All development milestones were achieved as per age. All immunization as per schedule. Childhood history: patient lived in Garhwal, Uttarkashi since childhood with her parents and siblings. There is history of temper tantrums and impulsivity present since childhood. No history of hyperactivity, inattention, repetitive bullying other children, stealing, lying, fire setting, or during childhood. Home atmosphere in childhood and adolescence. No history of broken home, desertion by parents, step parents, or adopted sibling. Patient has coordinated relations with her father and mother and her siblings. Sexual history: patient attained puberty at 13 years of age with the start of thelarche and pubic hair. No history of nocturnal amenorrhosis. Patient got married 10 years ago and has two children. She has adequate knowledge about contraceptives. The scholastic and extracurricular activity. She started schooling at the age of 5 years. She studied in the local village school till class 6, then went to the school in the nearest town. She was an average student in school. She scored 56% in class 10 and 50% in class 12. No history of any change in school. She was not shy in school and would easily make friends. She would speak up whenever she saw anything wrong being done. This would annoy her to the extent that she would scream at everyone. There was an incident at school where someone said something in foul language to a younger sibling. The patient got physically abusive with the accused. She started doing her BA, but had to leave it in the first year when she got married, as her in-law did not allow her to continue her further study. Premorbid personality: self. Patient is ambitious and would like to work in Dehradun to provide for her family. Social relationship: she had good social relationship with her parents and siblings. She, however, does not have any good social relationship with her husband and in-laws, and has a physically abusive relationship with her husband. She's aggressive towards her husband and in-laws when they have. She does not make decisions after consulting anyone. 2 years ago, after physically abusive from all this. Yes, but she became physically abusive from this. Intellectual ability: enjoys chatting with family members. Work and leisure: enjoys chatting with family members. Mood was unstable. She is able to express her inner feeling of anger and frustration. She gets angry on very minor issues. Character: she did not like taking responsibility of the household chores. She reluctantly helped her elder sister for the household chores. She was sensitive to criticism and would get quickly tempered. Habits: she had a regular sleeping cycle and rhythmic bowel and bladder movements. Impression is that there are impulsive traits in her personality. In general physical examination, it's an endomorphic built female. Her body weight is 74 kg. Her height is 148 centimeter. Her BMI is 33.8, getting into the category of obesity. Identification mark is 2 into 1 centimeter scar, 2 centimeter lateral side of the left eyebrow. There is no pallid clubbing, synopsis, or edema. Her temperature is afebrile. Her pulse rate is 84 beats per minute, regular in rate, rhythm, and volume. There is no radiofemoral delay. Her BP is 110 by 80 in the right arm sitting position. Respiratory rate is 22 per minute. In system examination, this bilateral air entry is equal. Her chest is bilaterally symmetrical. Trachea is centrally placed, and there is no added murmur. In CVS system, there is S1 and S2 is heard. Apex beat is present at the fifth intercostal space, medial to the mid-clavicular line. No added murmur. In GI system, abdomen is soft, flat, no dilated veins. Umbilicus is centrally placed. Bowel sounds are present. CNS cranial nerves are intact. In the motor system, the tone is normal in the upper and the lower limb, the right and the left upper and lower limb. The power is 5 by 5 in right and the left upper and the lower limb. Those cerebral or meningeal signs have been seen. I have just done one MSc, sir. The patient was just with us for 3 days. So in the first 2 days when I tried doing the MSc, she was very irritable. So just one MSc which I did day before yesterday. Endomorphic build female entered the room accompanied by her father, sat on the chair provided, did not meet the examiner, wearing a suit which is appropriate as per her social economic status. Clothes appear clean with unkempt hair, implying that grooming and hygiene was not well maintained. She appeared as stated age, appeared to be in touch with the surroundings. Eye contact is initiated but not maintained. Her attitude is uncooperative. Rapport is established. Psychomotor activity is normal. Speech is increased in tone, volume, and intensity. It is clear, coherent, and goal directed. Reaction time is normal. Attention was arousable. She was able to pay attention to the question asked. She was able to do double tap A test. She was not able to do 100 minus 7 after one correct answer. She was able to do 20 minus 3. Therefore, attention was sustained. The patient knows where she was and who has accompanied her and what time of the day it is. Therefore, the patient is oriented to time, place, and person. Immediate, she could recall 2 out of 3 words in recent memory. She had known what she had for the breakfast and the last night dinner, therefore intact. Remote, the patient remembers her birthday and her father's birthday, therefore intact. In construction ability, in reproduction drawing, she scored 2, that is good. And drawing to command also she scored 2, so that is also good. So the construction ability is intact. Abstract ability, patient was able to tell 2 similarities between an apple and banana. She was able to name 4 out of 5 items, therefore abstract ability is intact. In general information, she was able to describe the current situation of the pandemic and she was able to tell the use of the lungs, therefore general information is adequate. She was able to do simple and complex addition. She was able to do simple subtraction, but she was not able to do complex subtraction, and she was not able to do simple and complex multiplication and division. On asking the mood, she said sahi hai. Her affect is irritable, but mobility is labile. She started crying when I asked about her sons. Full range, reactivity, communicable, congruent, and inappropriate. What is normal streak? No common thought disorder. Content, there is a division of persecution towards the husband and in-laws and transfer position by the DNP. The verbatim I have received is, जब मैं आईसीयू में थी सब डॉक्टर ने मना कर दिया था कि मैं नहीं बचूंगी. माँ ने पेट की नली में आटा डाला, मैं सही हो गई. जब मायके से नीचे आई तब घर वालों ने जूतों से मारा, मेरी सारी माला तोड़ दी. तब वो प्रकट हुए, इससे पहले कभी नहीं आए थे वो, जब गलत हुआ तभी आते हैं, किसी के बुलाने पे नहीं आते, वो सही का ही साथ देते हैं. शक्ति उन्होंने ही दी है, बच्चे उन्होंने ही करवाए हैं मेरे. मेरे पीछे लोग लगाते हैं ये, सोचा है ये उल्टे काम करती रहती है, लोगों को मारने के लिए भी बोलते हैं, जूते चप्पलों से मारते हैं, मेरे खिलाफ साजिश कर रहे हैं ये सब लोग. ससुराल वाले खाने के लिए भी नहीं देते हैं, मेरी सास मेरे पति को आने नहीं देती है, कमरे में बंद कर देती है, सबको देख लूंगी मैं एक एक करके. Her judgment, her test is intact. However, the social and personal judgment is not intact. Inside is grade 2. Diagnosis. I have kept her on diagnosis of psychosis NOS with emotionally unstable personality disorder repulsive type, which I have gotten after putting the iPhone. And a secondary diagnosis of personality and behavioral disorder due to brain disease, damage, and dysfunction post-encephalitic syndrome. Psychosis NOS with emotionally unstable personality disorder impulsive type. And secondary diagnosis of personality and behavioral disorder due to brain disorder, damage, dysfunction, post-encephalitic syndrome. Psychosis NOS में अगर एक पेशेंट को साइकोसिस हो विद एपिसोड ऑफ ट्रांसिएंट पोजीशन तो इट इज कवर्ड अंडर साइकोसिस itself. ऐसे सर ट्रांस एंड पोजीशन में आईसीडी में लिखा है अगर आपको साइकोसिस साथ में मिलता है तो यू कैन नॉट डू नॉट गिव इट अ डिफरेंशियल डायग्नोसिस, इट इज विद इन द साइकोसिस इटसेल्फ, मतलब इट इज नॉट कंसिडर्ड अलग, उसी में कंसिडर करेंगे साइकोसिस। मैम पैरानॉइड भी है, थर्ड पैरानॉइड शिज़ोफ्रेनिया, बट शिज़ोफ्रेनिया के क्राइटेरिया फुलफिल नहीं हो रहे हैं तो इसलिए यस सर बिकॉज आई डिड नॉट फाइंड इट इन द एमएससी, शी जस्ट सेड पहले सर नो सेंसरी डिस्टॉर्शन because she told me that she could hear it previously but अभी नहीं आ रहा है जब से हॉस्पिटल है, but सर मैम वो सूडो hallucinations भी हो सकते हैं because there is no history of self smiling or self muttering, just the patient has given an account कि the देवता से है। all the criteria and to scale it to the extent that the rule of or state level hallucination data voices, but was the clear consciousness or not, was validity or not, was there any negativity or not, was there a belief or not, was there learning relation or not, was there a male voice or female voice. So that the and how to apply identity the two services. Sir, because the previous personality, what the history given to me for the pre-morbid personality is that only that she was physically abused. She was physically abused in the past also, but it was not unprovoked in the past. हाँ, मतलब but हमेशा ही का छोटी छोटी बात पे she is physically abusive but not unprovoked. Sir, 2 years. So, any kind of yes, sir. Why did you put that? Sir, I have written it in my pre-morbid personality that there is a physically abusive relationship with the husband. So the complaints which she has come from is तो सर हम yes तो सर हम हिस्ट्री स्टार्टिंग से सर बट ये साइकोसिस बट जो भी पेशेंट में एडमिट होता है हम तो उसको एडमिटेड में ही लगाते हैं तो वो साइकोसिस में तो yes sir सर बट उसकी चाइल्डहुड हिस्ट्री में भी और प्री मॉर्बिड हिस्ट्री में तो आई सेट की हिस्ट्री ऑफ फिजिकल is not be able to explain how a relationship were being affected. You will not be able to explain how her feelings were affected. Yes, sir. You will not be able to explain how she was coping when in society, when society was not there, when family was not there. So these things will point out that there is something in personality that should be evaluated. So what you are saying is, if I made a diagnosis of personality, my history should be from previously, not from 2 years.
First of all, yes.
Then there's no.
Psychological area of the pre-COVID personality is actually नेशनल को बिफोर पर्सनालिटी की पूरा हमें सजेस्ट नहीं करती है कि हमारी हिस्ट्री लेना है but it is very surprising कि हमारी हिस्ट्री में इतनी सिग्निफिकेंट है life is so much affected अगर पेशेंट को है तो आपको तो मतलब साइकोस का डायग्नोसिस करना पड़ेगी क्योंकि वो इतना गलत करेगा उसकी मतलब लाइफ को और देन इट इज पार्ट ऑफ साइकोटिक अब आपने
Yes.
थोड़े से बोली है वो आगे भी क्लियर कर सकते हैं नहीं तो क्या होगा साइकोटिक और डिल्यूजन तो आपने डिल्यूजन परसेप्शन का आपने इमोशनल डायग्नोसिस बाद में किया लेकिन आप डिल्यूजन परसेप्शन का बैटिंग बोल रहे थे वो आप ये बोल रहे थे मतलब डेंगोस को पर्सन लगती मेरे को तो पावर और परसेप्शन में तो बोला कि मारते हैं
सर वो हिस्ट्री में बताया पीछे कर रहे हैं
there are big kind of different this kind of problem which are to some extent part of adult life and then again they can microculture into other consistent and psychological
so we
my
can
point is it can still be cases with opinion अगर हमारे सारे बेटे है but और it can still be अगर इवन तो मतलब कितना 2 साल में एकदम डिटेरियोरेट हो गया है
so there is 29. So 2 years ago, there's a significant history of scrub typhus when she suffered through encephalopathy, for which she was admitted to the ICU. That is why her differential has been given as personality and behavioral disorder due to brain disease damage. उसके 20 days बाद start होगा सर उसमें exaggeration of a previous personality भी होती है तो वो भी उसी
अभी आपको 2 years क्लियर ऑनसेट मिल रहा है प्रॉब्लम
Yes, sir.
years ऑनसेट बिल्कुल क्लियर है जो प्रॉब्लम है पहले नहीं 47 के सेल की
Yes.
अगर पर्सनालिटी मेन प्रॉब्लम होती है उसकी तरह अब ऐसे नहीं होता है एग्जैक्टली वो सारे प्रॉब्लम शुरू हुई है और एडिस कितना है
10 years.
10 years 8 साल से पहले फैमिली के साथ लगभग
manageable थी sir, but it was a physical abusive relationship between the husband and the wife, the patient and the husband. But now she has involved everybody. Now she is physically abusive to the villagers, to her children, to her mom. Yes, yes. Yes, sir. All so first I will see the temporal relation between the organic and currently, and then I will see if I remove the cause of the organic cause, is there an improvement or not. And so I will, if it's a psychiatric illness, I will get a clear-cut picture of one specific diagnosis, but in an organic cause, it will be a mix. So I raised the same questions with the patient, but she was unable to answer them. So I feel they were more of a pseudo hallucination. सर की कब आती हैं और वो आपको कुछ करने के लिए बोलते हैं, वो आवाज कि जब ये आवाज आते हैं आप उस वक्त क्या कर रहे होते हैं, 2 लोगों की आवाज आती है आपके बारे में बात करते हुए कि एक जने की आवाज आती है. Yes sir, this was clear कि बाहर से आती है. Ma'am, she did not answer much about that. Self-muttering. नहीं मैम, घर पे भी नहीं था. Nobody has supported me.
लास्ट में कोशिश कर रही थी लास्ट
Before getting admitted in the hospital, that's it. He's घर पे आती थी. So can this not be in the theme that she believes that everybody is wanting to harm her? So it's more of a defense mechanism. That
तो क्या बोल रहे हैं
ये हाँ,
other than that कितना कंट्रोल था सब्जेक्ट था और अब अदर थिंग वी नीड टू इवैल्यूएट कि इस मोबिलिटी पहले कितना मतलब उसकी फैसिलिटी टीचर से कितना डिस्टर्ब था whether that was the level of disorder of the to the level of grades
ma'am, the husband, I just spoke to the husband over the phone. He did not come. कि ये हमेशा से चिड़ी हुई रहती है कि ये काम नहीं करती, घर पे लेजी है, कि कुछ काम धाम नहीं करना होता है, और जब बीमार हो गए तो बिल्कुल ही काम करना छोड़ दिया. नहीं, काम हमेशा मैम वो मैंने बताया भी था कि she does not like working. She has to be forced to be work like काम. And she wanted to further do her studies because she thought she was getting married in Dehradun and she was from Garhwal, so she thought that her family would allow her to study and to work, like go outside and work. That is what she wanted to do, but they did not allow her. So that was also the reason of the dispute. Sir, yes, sir, because according to the history, it is clear that she believes her husband is having an extramarital affair, and she also believes that the mother-in-law is plotting against the wife by taking the husband away and locking him in the room. That the 76-year-old woman does not allow the husband to leave the room. And she believes whenever she's stepping outside the house that somebody is following her, that they have asked her to be followed because they are talking about her character. And then, ma'am, सर फैमिली तो नहीं कह रही कि ऐसा कुछ नहीं है, बट अब हाँ, and then after with the passage of time, when the father also came and started explaining to her that she's ill, then she also started believing that the father is plotting against her. Yes, sir. Yes, sir. Sir, 2 years से लेसे around 1 year से suspiciousness है. Yes, sir. सर उसने जैसे अगर वर्बैटम नहीं बोला सर, जैसे पेपर में अगर बोले ना तो क्या हम वर्बैटम में क्या बोलेंगे, जैसे अगर मुझे हिस्ट्री में मिल रही है डिवीजन परसिक्यूशन तो तुम आई शुड have ideas of persecution. सर बट एमएससी तो उसी समय की हो गई ना, तो इसलिए हम तो it's a safer नहीं सर, मैंने कोऑपरेटिव बोला, गलती से उसके बाद मैंने उसे दुआ से करेक्ट कोऑपरेटिव. And you 20 minutes or 40 minutes. No, sir, it is a part. I did it because of the organic damage. So, construction. सर पुरानी है अभी वाली. नहीं सर, वो क्लियर ही नहीं थी, मैंने मैम को पूछा, इट वाज नॉट विजिबल। सर तो कंस्ट्रक्शन एबिलिटी करनी होती कि नहीं होती?
बहुत सारे कॉग्निटिव टेस्ट होते हैं, ठीक है, अगर तुम कोई भी वेट को ये नहीं कर सकता, इसमें ये क्यों कर दिया, हमने आपको चेक करना था कि तुमने डी में क्या, बट all this does is attract extra portions and extra usage. कोई ये नहीं कर सकता, आई कैन नॉट से तुमने क्यों ये नहीं करना था, व्हाई आई विल से, ठीक है, अगर आपको कुछ वैलिडेट करना चाहते हो तो इट्स नो पॉइंट, बट इट इज यूजुअली हेल्पफुल इन कंप्लीशन at least
To not mention.
to stick to the structure for the this structure has been made to maintain consistency and to evaluate all the basic requirements of the psychiatric state evaluation. But this is not that. Of course, after this evaluation, this only helps to have a provision test. After that, it is our job to see which testing is whether lab testing or say radiology testing or psychological testing or which testing is required. Okay. So then we can tell and anything even in general evaluation does this if they are not wrong, but they get an extra questions. And usually they are not visited by this because they are not required to make it for okay, हम सब कुछ हो रहा है सब कुछ डाल सकते हैं उसके बाद देखेंगे हम कोई सीरीज से वीक का पार्ट बना सकते हैं इट्स नॉट क्वाइट एवरी इसलिए ये सब बनाया गया that's why it's not wrong.
I will attract more question if I do.
अच्छा ये क्यों सोचा कि ये जरूरी है सो
पेपर में नहीं करना। I would like to manage the patient in an inpatient basis, considering the aggression and the behavioral disturbance. I would send sample for CPC, LFT, KFT, and RFT, and would do serial MSC to assess the illness. For active management, I'll start with injectables, antipsychotic, as the patient is uncooperative, and aggressive. I will start with IV haloperidol 5 mg and IV promethazine 25 mg, and would also go with IV benzodiazepine to sedate the patient to chemically restrain her. IV benzodiazepine. The aim of the rapid tranquilization would be to reduce suffering for the patient, the psychological and the physical, and to reduce the risk of harm to the family by maintaining a safe environment. I would regularly monitor the patient's temperature, BP, pulse, and respiratory rate and level of consciousness, and see for any side effect. After the active management for maintenance therapy, I would start the patient with the first generation antipsychotic, considering the metabolic profile of the patient. I would start the patient on oral haloperidol, and I would psychoeducate the family about the importance of the treatment and regular follow-up. I would start with the family-focused therapy to assess the family, to identify the dysfunction in the area of the family, and make a management plan according to the family. First time. Yes, ma'am. वो जो मैंने father वाला incident बताया था, that when her father was called down to explain it to her, then she started being physically abusive and like very verbally abusive towards the father as well. Then the father got her admitted. Great. No, ma'am, not currently. In a regular follow-up, because they took her on a DOPR after 3 to 4 days only. So if after a while when the psychosis is clear and insight develops, then compliance will. Because we used to tell her to start with it. बहन के पास गई.
Why was the parental presence?
Sir, to sedate the patient because she was very aggressive in this.
Is it parental help
Yes, sir, it is.
as this combination?
Sir, it does. Sir, the weight of the patient is around 76 kg, so we may need more.
So first time in school, students I got with no vascular psychotic exposure. Is this combination of tetracycline with antihistaminics with high potency antipsychotics carries any risk?
Yes. Cardiac. Sir, cardiac risk.
What else?
Sir, and respiratory failure if I give a lot of antidepressant. Respiratory distress.
You start with this. You let the pills.
So I will just start with the injectables, and if I can give an oral form of benzodiazepine.
Start with a little bit of this haloperidol better.
Sir, haloperidol and promethazone is a better choice because of the because of haloperidol has chances for EPS. So just to give a yes, sir, benzodiazepine.
Five more first generation antipsychotics to a patient who is young female.
So because of the deranged metabolic profile.
Patient of what is the guidance? What is the first line choice in case of schizophrenia? In metabolic. What is the first line? Currently, no guidance, just first line antipsychotic as first choice in any scenario. We choose from the available secondary of the guidance. As well as the all the guidance, I will not get all the guidance. First choice in case of first time diagnosed psychotic disorder is second generation antipsychotic. The antipsychotic, but it has to second generation. And they clearly say offer the patient second generation antipsychotic, which has to be among these, which are both these
Risperidone.
and
Olanzapine.
there are three or four drugs from guidance mentioned have to offer to the patient as first treatment for psychosis, and they have drugs.
I repeat the मेटाबॉलिक प्रोफाइल की वजह से So then lorazepam would be a good option because it helps in aggression as well. लिखा हुआ था safer yes aripiprazole would be the choice. Cariprazine safer consider that younger female. उसमें aripiprazole लिखा है. So I wanted to ask something. जैसे patient ने drawing to command में like a dementia patient makes watch clock ऐसे बनाइए तो is this anything significant? I asked her to make 10:30. Sir, एक तो it is not a three-dimensional picture of the house like asked her to. Sir, and the pot is smaller than the flap. Sir, normally the pot ज़्यादा
आप लोग पे कमेंट करो उसमें क्या क्या पॉइंट्स हैं देन यू विल सी कि वो कहां क्या क्या है मतलब क्या उसमें हम कैसे बनाएंगे वो क्या क्या
Sir, roof is smaller. थोड़ा सा compared. Clock. So clock has three. Normally, she is maybe making minutes, but that is hardly unlikely. No, sir. So time to So the time is wrong. I asked her to make 10:30, and if she was making three different arms for different hour, minute, and all, then they should be of different length. हाँ सर दे रखे हैं.
अगर डाटा कोड्स हैं आगे ब्लॉक में तो वो क्या क्या पॉइंट करें एक्चुअली डिफरेंट है बस डिफरेंट ठीक है देयर आर मेनी the log is not a good sum.
Yes sir.
The digits are not placed exactly where they should be. The length of arm is not significantly different as it should be. And the timing mentioned was not very ये चार पॉइंट्स हैं अभी ये देखना होगा हमें क्या बताना चाहिए कि हम क्या क्या इसमें लिख सकते हैं क्या क्या आप इसमें क्या वीडियो स्पेशल ओरिएंटेशन डिस्कवर वगैरह उसकी कंसेप्शन एबिलिटी डिस्कवर उसका देखना पड़ेगा इसके बाद हमने क्या करना तो एक हम लोग बताना चाहिए अगर क्या क्या पॉइंट्स हैं तो क्या क्या हमारी इंप्रेशन है
पहले कोई दिक्कत नहीं. Banana. People cannot. Tension. कितने आर्म्स Thank you. जो हमें पर्सनालिटी लगाते हैं, हम तो सारे पेशेंट में लगाते हैं साइकोसिस वाले, तो वो गलत करते हैं। जो आईपीडी लगाते हैं, ये सब ने बोला साइकोसिस में कैसे लगा लेते हैं? जब पेशेंट एडमिट होता है
एक्चुअली तो नहीं लगाना चाहिए।
तो हमें सब क्यों बोलते हैं, मतलब सारे कंसल्टेंसी तो मुद्दे लगाने के लिए, तो गलत है।
एक्चुअली हम नहीं लगाते हैं, मतलब हम उन्हीं को लगाते हैं ना, जैसे मैंने
जिसके लिए श्योर है कि हाँ साइकोसिस
जैसे भाग रहा है और ये कर रहा है,
बट अच्छा अगर किसी में कंफ्यूजन है साइकोसिस और पर्सनालिटी तो कोई लगा ही नहीं सकते।
चलिए इसको देखो पर्सनालिटी हो सकता है, लेकिन अभी तक तो साइकोसिस है,
हाँ,
इसमें
अभी
डाउट नहीं है।
पहले का
हाँ साइकोटिक है ही वो।
हाँ मैम, पहले मुझे लग रहा था मैं गलत सोची साइकोटिक में, बट तब साइलेंस में नहीं लग रहा उसको। उसके हस्बैंड और सब डिफरेंट हिस्ट्री बता रहे हैं। मीना मैम का आया